Hi friends. Well, we are again in the second session of knowing orthopedics. When I was small, I used to remember I used to go into the garden with my father, and then I used to see a butterfly. The butterfly used to jump. The butterfly used to fly, different colors, different hues, and every time I used to see it differently. Well, orthopedics is like that, and that magic garden learning which my father gave me, I started sort of liking photography. And let me tell you, every orthopedic surgeon by itself is a photographer. He has to go into the depth of the knowledge. He has to go into the depth of the composition which he wants. Whether the figure has to be centered, whether the figure has to be on one side, what should be behind the figure, whether it has to be out of focus. The same thing goes in orthopedics. Orthopedics is not only that I eat well, I do exercise and I'm all right. No. It is understanding the property of a particular muscle, the property of a particular joint, and again, as I had said last time, the posture of a person. Whenever you are working, your posture, again I repeat, is very, very important. So as when we are talking of running, or when we are talking of low backache, what helps and what doesn't help is something like a photographic view. If I have to take a photo with bright sunlight, the whole photo, the whole image will get spoiled. If I have to do exercise after eating a lot, the whole exercise will get spoiled. What is more important to know is when to do exercises, when to click a photograph, when to see the photograph as yellow or red, what angle to click the photograph, what angle to do the exercises, what time to do the exercises. So everything is orthopedics, and photography is something which is let me hand in the glove. If you understand photography, you'll understand orthopedics very well. Outdoor photography, for example, how I have seen a simple example. जैसे अपन बात करते, कोहली ने जाल लगाया, उनका जो वेब था वो लगा दिया, वहाँ एक बूंद गिर गया, एक बूंद पानी का गिर गया। कोहली बोला कि कोई भी फंसेगा और मैं खाएगा, नहीं हुआ। और एक बूंद गिर गया, और एक बूंद गिर गया। एक फोटोग्राफर वहाँ खड़ा था, वो देख रहा था, the spider spinning the web. And what was the ultimatum? There were a lot of drops, dew drops getting together. You know what was the end picture? The end picture which the photographer shot was a necklace, a beautiful necklace with the dew drops like a moti bindu, with the dew drops like pearl. And it was a different picture totally. How you look at a particular thing. I do exercise, I get pain. Well, after exercises, you might get pain in the initial instance because your life or your body is not accustomed to those exercises. So, most important is toning up your body. Most important is warming up your body. Most important is to see that your body goes to a scale, to a height wherein you can perform and where you can do things. Friends, what I want to say is, every particular angle which you see, every particular subject which you see can be like a coin. It is not the Chole coin where both the heads are there on either side. It is a coin wherein you see a head and a tail. A coin wherein you see a positive and negative. A coin where you will see the two aspects of life. You know, I had a professor, our dean. Whenever we used to ask him a question, he used to say, I remember he used to say, oh, there are two things. My one mind tells me this and my other mind tells me that. So even in photography, even in orthopedics, there are two things. One is the conventional part of treatment and other is the surgical part of treatment. As a surgeon, You know who is a good surgeon, who is a bad surgeon, and who is the best surgeon? A good surgeon is a surgeon, or rather, a good surgeon is a surgeon who knows when to operate. A bad surgeon is a surgeon who would like to operate everybody. No, it is no surgeon is a bad surgeon. But who is the best surgeon? A best surgeon is a surgeon who knows when not to operate. That is more important. Similarly, when to do things and when not to do things. When to see things as positive and when to see things as negative is very important in life. Now take for example plain simple backache. You have plain simple backache. What do? You'll take a pill. No. Understand your back. Think. What has caused that backache? Strain? Bad posture? Traveling? Lifting weight? What? Is it the first time I have? Is this going to have be again and again? Well, then I should consult a doctor. But the first thing what you should do is rest. And while taking rest, if you feel relief, try to flex your legs. Try to make an angle. Try to decrease the lumbar curve, the lordosis, and try to see how you feel. If you feel better, then yes, probably this was the start of the story and you are controlling it. What you require is, you have overexerted yourself. What you require is rest. So rest is very important. See, there was a terminology when we were students, they used to tell us, remember rice, rest, ice, okay, conventional treatment and elevation, or rather compression and elevation. That was the treatment which was given for everything, whether you have a fall, whether you have an ache, and that treatment used to work. Similarly, whenever you have backache, please do not pop medicine. First, take a rest, see how you feel. Ask yourself whether it is recurrent. If it is an acute attack, the first attack, there's a good chance that you have overexerted yourself. It is something like putting 4 TVs on a table. It is going to crash. Why you want to see that your back crashes? Why you would like to see that your back is not responding to the function or to the work which you would like to do? The second thing what you do is cold compresses. Apply ice. Any gel, any painkiller is okay. But remember one thing. The muscles, the fibers are in a particular direction. Respect that direction. The spine is like a pillar. And the direction is like, you have seen Rajiv Gandhi C-Link, how the things are arching and holding the bridge together. Similarly, the muscles, they try to hold the spine together. And if you do it in the wrong direction, or if you start rubbing, it is going to give you more pain. It is going to hurt you. What you have to do is, in the direction of the muscle, usually we advise above, downwards, outwards. That is the way it has to be applied. Now, if you feel the next day after taking rest of 4 hours, 6 hours, you are comfortable, yes. Try to analyze. If there is something like an overactivity, you see that yes, I go beyond a certain thing, I get pain. Well, it has to be investigated, but you can control your activities. Take a gap in between, an intermission, an interval in between, and then work out. That is more important. The moment that is over and you feel that you are getting recurrent, that is the ringing of the bell. What you will have to do at this time is to get yourself plain simple x-rayed or investigated, or go to a doctor and get yourself diagnosed whether this problem is a skin problem, a muscle problem, a capsule problem, a bone problem, a spondylotic problem, a disc problem, or a nerve problem, or a vascular problem. So whatever the problem, once it is located and expected by a doctor, you can be treated in a similar fashion. In life, what is most important is, any situation, never get panicky. Face it, treat it, and you get the response. If you become panicky, if you try, and at the same time, let me tell you, you should not ignore. You should ask yourself what might have caused this. Why it was not before and why it has come suddenly. Is my body not responding properly? I have to get it diagnosed, and I have to. Then there are other investigations like MRI, like CT scan, depending on the condition which you are in. So, friends, what I'm trying to tell you is maintaining the body. Yoga will help. What is the difference between yoga and exercise? It is simple. Yoga is part of exercise. But if you do it in a rhythmic fashion, with respiration, with inspiration and expiration, then yes, you are doing yoga. Now, for example, I would like to do Uttan Padasana. I try to take my leg up. You know what? Usually, some teachers, yoga teachers, there are two schools of thought again. Some yoga teachers say that when you are taking up, take it in, and when you are putting it down, breathe out. What I tell the patient is, what is more important for me is training of the muscle. When the pain factor is under control, I tell the patient, you take up. But when you're taking up, relax, normal breathing. But when you take up, hold your breath. The whole idea is sustaining. The whole idea is maintaining. The whole idea is controlling. The whole idea is toning. The whole idea is making the muscles strong. And that is what is required, friends. That is what is required. And then you take it, you maintain it, take a deep breath, hold, count 5, leave it, and then take your leg down. This particular exercise, if you do it 5 times, many back exercises are there. There are back flexion exercises like this Uttan Padasana. There are extension exercises like Salavasana, Ardha Salavasana, one leg up in prone position. Then there is a Bhujangasana when you take your neck and the leg up. And there is a Naukasana wherein you take one leg up, one hand up and the opposite leg behind. So there are many exercises to tone yourself. What is the moral of the story? Don't wait for a problem to come. Face the problem. See, it's like this. When we were in 11th, we were told that, oh, you have to do interscience and you have to get so much percentage, and then when you get this percentage, you'll get medical or engineer, whatever you want. Similarly here, we have to start studying there. You have to start studying right from 11th standard, and the whole of interscience, that is first science, interscience, now they say 10th, 11th, 12th. The whole idea of studying is coming to a particular level, a repetitive act. Similarly here, in order that you should not have a back problem, control your weight, control your diet, do proper exercises, do specific local exercise for the back so that your back remains in a sustained form. It is strengthened and it takes control. The disc is not, the muscles are the jawans of the body. They will take your catch first. And if they cannot bear, then only it will go to the capsule and the disc and the nerve. Try to avoid that and see that you do your normal activities, see that you do your normal problems, normal daily course without any pain and without any difficulty. Thank you, friends. Again, before closing down, I would like to remind you, subscribe. We have to interact. We have to be together. We have to meet every Monday. And with that, the simple knowledge. When you're talking of backache, before I close down, I would like to give you one more example. I have a car. I have backache. Or I am a patient of backache. Today my back is fine. How you'll enter the car? Will you enter head in? Never. Open the car door fully. You face outside and come yourself inside, and then rotate yourself and sit it in such a fashion that your legs are ahead and you are erect. Do this, you'll never get a catch. Do this, you'll never have a problem. Small things in life makes a difference. A stitch in time saves 9. Bye friends, thank you.